computer. There we go. Thanks everybody for joining us. We have another episode of Fertility Talk, and this time we're discussing genetics and the role of genetics when it comes to miscarriages. Obviously, our topic has been miscarriages over the last few days. And we are talking to Kelly, and Kelly is from Nextbio. So thank you and welcome. Thank you for joining us here today, Kelly. And yeah, like I said, we are talking about miscarriages and the genetic role, what the genetic factors that contributes to miscarriages. Please introduce yourself, Kelly, and tell us where you're from, what it is that you do at Nextbio.
So my name is Kelly. I'm the in-house genetic counselor at Nextbio Sciences. So Nextbio Sciences is a genetic testing laboratory. So we do a number of different genetic tests along the reproductive pathway. So I work there to assist from a laboratory perspective, but also to speak to clinicians and patients when needed. And then I also consult patients in private practice.
Okay, perfect. Thank you very much, Kelly. So we've only got a few questions for you. And we're going to start off with the first question. It is, can you discuss the role of genetic factors in miscarriages?
So unfortunately, we know that quite a large number of pregnancies, early pregnancies, will end in a miscarriage. And in about half of pregnancies that end in a miscarriage, that will be due to a chromosome abnormality. So you may recall that in most of the cells of our body, we should have 46 chromosomes. So if there's anything extra or anything missing, that can lead to a problem with the development of the pregnancy and may result in an early pregnancy loss. And we see that in about, as I said, 50% of early miscarriages can be due to a chromosome abnormality.
Okay, thank you. And then what testing options are available for individuals or couples seeking to understand genetic aspects of pregnancy loss?
So at Nextbio, we offer products of conception testing or POC testing. So what that test is aiming to do when there is an early pregnancy loss, some of the tissue from the miscarriage or pregnancy loss will be sent to the laboratory. We then have our scientists assess it to make sure that the tissue that we are receiving comes either from the placenta, the villi, or the fetus, so that we can make sure that we are testing tissue from the pregnancy and not the mother's tissue. And then we will do testing in the laboratory to see if there was any chromosome abnormality, so any extra or missing chromosome material that may have led to that pregnancy loss. And what that then does is, in a large number of cases, so I've said about 50% of these losses are due to a chromosome abnormality, for a large number of couples, it will provide an explanation for why that loss happened.
Okay.
And as we know, often when you experience a pregnancy loss, the first question you ask is, why did this happen?
Why?
Was it something that I did or didn't
Yes.
do? Is there anything that I can do differently the next time to prevent this from happening? And having that information about why it happened, we find is so valuable when I speak with patients. It's probably one of the tests that adds the most value from an emotional and psychological perspective, because being able to give closure to couples often helps with moving on to the next pregnancy. And if we are able to say that the chances of this happening again is quite low, so based on the outcome of the test, that can be quite reassuring for many couples. And then also in a very small number of cases, the results may then tell us that perhaps we should be looking at some other tests that need to be done for this couple to clarify that there isn't a higher recurrence risk. So the information that that test provides is really valuable. And then in the proportion where we don't get an answer, so where we see it's not due to a chromosome problem, in those cases, the doctors can then make sure that they've excluded all the other causes of early pregnancy losses. So it helps them then to focus their investigations as well going forward.
Yeah. Just a quick one. Do you think that is it after how many pregnancy or how many miscarriages would you say, okay, I think you should have that test done? Or is it like, after the first one or so forth?
So guidelines around this vary, and the approach that clinicians take varies quite significantly. So some clinicians will only start doing this testing after a second or a third loss. But
Okay.
what we find from a patient perspective is having this information even after a first loss is incredibly valuable. It
Hmm.
may change what your doctor is going to do, but it helps from a psychological perspective and the emotions and everything tied up in an early pregnancy loss that, in my view, I think that there is benefit to considering this even from a first loss,
Yes.
um, because you then have potentially an answer for why that happened. And when that is often one of the biggest questions, I think that's really valuable information to have.
Wow. Actually, as you were saying that earlier, I was actually thinking that actually makes sense because that is definitely the first question you'd ask yourself. What did I do? And you go on, continue, you know, trying to say that you did this wrong. Maybe I should have done this, or maybe should have done that better. Um, but when you're getting an answer, it absolutely would help you mentally, like, okay, understand this is what happened and now this is my step, my next step. You can actually heal from it, because it's not something that is just like, oh yeah, it's a miscarriage and that's it. It's quite a big thing, especially when you're dealing with infertility and you've been trying a long time. So I think this is amazing. Thank you
Yeah.
for that. I really appreciate that.
Yeah, and I really do think that having that information, because we always try to find reason and
Yes.
explain why did this happen, and it can take a lot of that away because often what we see is that patients will look for ways to blame themselves. They
Yeah.
did this or they didn't do that, and if we can take that away, it just makes progressing a little bit easier and approaching a future pregnancy with less anxiety and
Yeah.
worry.
Absolutely. Wow. Um, Kelly, if you can just tell us how do they get hold of you or Nextbio if they are looking for the service? Do they go to their doctors and they get hold of you? How does that work?
So, for anybody that has unfortunately experienced a pregnancy loss, if this is something that they would like to request, they can ask their doctors to assist them. They can also contact us. So we have a website address, so www.nextbio.co.za, or we also have an email that they can contact us on at genetics@nextbio.co.za. It's a lot to remember when you're going through something like that. So I think your first port of call probably should be your doctor,
Yes.
then to say that this is a test that you are aware of,
Yeah.
and is this something that they could help you to facilitate?
Yeah, and I think you guys do work with most of the fertility clinics and
Yeah.
guys and so forth around SA. So that's perfect. Thank you very much, Kelly, for joining us. This is very insightful, and I'm sure this can help so many women out there. So if you guys want to get hold of Kelly, actually Next Bio, you can visit their website is www.nextbio.co.za, or you can actually just give them a call to the website and give them a call. They are also on Instagram and Facebook as well, so you guys can check them out there. But thank you very much for joining us and have
That's
a
all.
lovely day further. Thanks, Kelly.
Thank you. You
Bye.
too. Thanks for having me.
Bye.